All right, hi everyone. I am Frank. I'm here with AJ, the Team Garbo founder and visionary. I think we have reached out on social media, talked about doing this questionnaire. We've gotten some questions in from our community. We've also kind of just set up some discussion points between ourselves, and really the goal here is just to kind of let everyone a little bit under the hood as far as how AJ's techniques, his history, and then just the friends and family perspective of mental health, and specifically for AJ bipolar disorder. So without further ado, I think we're going to start this off with any intro words from you.
Yeah, just really happy to share a little bit of insight, maybe a little bit of my story that you viewers haven't known before, some insight that could possibly help you, and opening it up more so everyone's understanding kind of the possibilities of what's happened with someone dealing with mental health or has been through certain instances as well. We drew up some questions as well as what we received, and looking forward to Frank and I having a deep discussion on it.
Great. So why don't we start off as far as just for anyone that may not know, tell us a little bit about your specific diagnosis, your history with mental health, kind of just open it up from there.
Yeah, just as a standpoint, 7 years ago, right around this time, I was diagnosed with bipolar disorder. I am manic depressive, which means typically shows signs of mania before depression. With that being said, I have been hospitalized for my illness 3 separate occasions, and I take medication daily for it. I'm on mood stabilizer, antidepressant. I go to counseling, I want to say every other week, every 3 weeks. I have my own psychiatric doctor as well that handles my medications. So it's a constant part of my life that 7 years ago we didn't see it coming, but this is kind of how we adapted, and as the stats say, and as people are really starting to understand, a lot of people have these mental illnesses, and so having it being a part of your life is extremely normal if it does come across it, and it's just something you have to learn to live with and thrive with. So that's basically my little backdrop of my mental illness.
Great. So with your, as you mentioned, with your bipolar disorder, you mentioned the, episodes of mania, those manic episodes. Let's kind of talk a little bit about those episodes. So, as they're approaching from your instances, do you have any indications that you're feeling like you might be going into a manic episode, or any feelings, that you're aware of before those come on?
Yeah, that's a good question, and something I probably should have said right away. When someone uses the term bipolar, it's usually tongue-in-cheek, and you think, very highs high, very lows. But it is a real truth of, my day-to-day life, to, not only have that be a reality of, manic episodes or, mood swings. And for the most part, my medication really helps out with keeping my mood stabilized and, keeping any swings from happening or anything for onset, mania. Just to pick that back up, what Frank's asking with the mania, it's been very challenging, especially when it first came on 7 years, as you know, to recognize the mania. I'm a very high-functioning human being to begin with. I was a 3-sport athlete in high school, honor roll student, worked very hard, also enjoyed a great social life with a lot of different, groups, and, kept myself at a really, really busy pace. Going to college, did the same thing, played collegiate football, worked really hard in the classroom. So being told that I had bipolar disorder by someone, I thought they were just wrong. I just thought, no, bipolar is up and down. I have no down. I'm just up. So at first it was really tough for me to really take it in that I had something wrong, when really I didn't think anything was wrong with me. And It was challenging. I didn't see the mania kick in. The mania, really, you get a sort of bit of a high, and you don't think that anything's wrong with you. You actually think you're operating better than before, and so it was challenging. It's tough. It's really tough. It was tough, and I've been in the hospital for 3 times, and 3 times, every time I've noticed the mania comes in a little bit differently. I've had to get 302'd, which is really an issue for the law enforcement to step in just for your safety, to kind of get you to a hospital. So it will get to periods of time if you don't recognize it and get in front of help. So definitely tough to see, but you need to, at least what I do, and we're talking 7 years of, for the most part, really good health with this diagnosis. So, I mean, for the most part, you have to really stay on top of your stress levels. You need to stay on top of your triggers, and you need to be aware of what's going on right now in the present time, having this mindfulness. That's a really, evolved question that you're asking me here. So, the mania itself, it's tough to find, but it's just like you need to work on it every day to be looking for it. And the past couple times that I've had to be hospitalized, I have reached out for help and just haven't had the right avenues or the right urgencies to do that. And going forward, I have plans with loved ones and close friends of maybe in an action plan if something happens with my mania. We do have medication set aside, which we didn't have before. So it's really tough. It's something you have to take very seriously, but it's a day-by-day process of living your certain life and being grounded with yourself and knowing, hey, something's wrong, and then, hey, when something's wrong, where do I go for help? Before you get to this state of mania where I have delusions and I'm talking to God and I'm running around doing these wild, reckless things that I would never do in my entire life. So it's really important to not have this stigma that like, why no, it's not happening to me. And I say this now, and it's extremely challenging. Every time it comes up. I've been faced with some times in my life where I've handled it very well, and there's other times that I'm not acting with enough urgency. So
yeah, and I think you've always been very open. Obviously doing things like this, very open, talking about it. But I think it is worth noting, right? That doesn't necessarily mean it's comfortable.
Yeah,
and I think that's something that I would imagine a lot of people just across the board, right? Bipolar or not bipolar, any kind of mental health issues that they're having, probably don't experience that same level of comfortability or, perceived comfortability, right? It's probably, I think as you just said, right, it's not comfortable to talk about. It's uncomfortable, even just with the friends and family who've been with you through it all. So I think it's something that, once you acknowledge the fact that it is uncomfortable to talk about, and you just kind of talk about it anyway, right, and trudge through, I think that's where you make gains. That's where you make progress. And I think, to your point, right, from the friends and family perspective on your specific, manic episodes, just having bipolar in general, it's been 7 years and it's a work in progress, right? Do you feel like it's changed at all? So your knowledge of all of those past experiences, do you think it's changed at all how your day-to-day, how you approach certain things, how you manage your lifestyle? Has it affected any part of your regular life outside of those, outside of your manic episodes, right? Just normal day-to-day.
Yeah. I mean, to be honest, Frank's been here through it all with me, and he's been there for all 3 hospitalizations, and in every circumstance. If we go back to the first one where we were deprived of information of what's going on, we had no idea what was going on, no idea what to do, and we everyone was coming together and really helpful, and this is core value of what we do here at Team Garbo as a team. a lot of people don't have what I have, and this is why I want to speak out and say that, like, hey, we need to be prepared for mental illness. We need to work together. We need to be okay to talk about what everything's going on. So, the whole first 7 years ago, like it was new to us, and then even obviously a hospitalization isn't a good thing. It's not something. It's good to get help. It's good to get back, and hey, like at the end of the day, sometimes you need to go to the hospital just to get your meds right, and get your chemical imbalance, to get your sleep back, to get your eating right. And in the second time around, I mean, I know I tried on 3 separate occasions calling over to my doctor's office, but it was very laissez-faire. I was like, I don't feel good. Let me call to my doctor's office. But you know what? I've always been tough. I've always been like, hey, I can muscle through it. I mean, I've played football games with separated shoulders, concussions, thigh contusions. So it's not the same thing. And so I'm learning this as I'm going. I'm learning. That like, fuck, like I need help. I need other people. I need to be vulnerable, and it's not easy to just flip a switch and do that. And it was tough. So I mean, the second time around, I had to get hospitalized, 302, and I called the office, a couple weeks before, the week before, just saying like, hey, I think I need to get in there, but not knowing, not learning from, I learned enough from the first time to, hey, maybe we should call, and and then here comes the third time around. Everything really, happened within a 10-day span of all this workload and this stress and this lack of sleeping. But I thought it was my back pain, and here goes AJ pushing through it. But then I have a conversation with my dad, and he's like, son, we need you to get to in front of a doctor. They're open at 2 o'clock. I think something's going on. And I said, okay, let's go. So I go with, Christina, my father, my girlfriend, and, I expressed that it was my back, but, something's wrong, but wasn't really diving in at like, hey, this is not your back, this is your mental health. I needed a medication right there. The next 24, 48 hours, as being a part of that night, I couldn't do anything. I just went down this rabbit hole of mania. So to answer your question, each step, I got in front of a doctor that last time, and the next step I took is I got a, prescribing doctor, and I said, hey, listen, like, this is what happens when I get manic. It really ramps up, and I tend to really like muscle through things, which each and every time has been less muscle. But when you get to a certain point of your manic episode, you're not in control. You don't have that control. But there was a point right there where I was receptive enough to listen and talk, and I knew stuff was wrong, where I would have taken a medication if it weren't in front of me. So now we have this emergency medication. It's an antipsychotic medication that will help me out, and we take it, and we have a protocol of what's going through. So, I mean, it's not easy, and I don't wish anyone to go through the hell that I've gone through, the way I've gone to a hospital, what those lonely moments are in a hospital when you're battling through this mania. But I have learned tremendous amount. The people around me have learned a tremendous amount, and that's why I really hope to be an example. So, when someone's diagnosed bipolar, they make a plan of action right then and there. Here's the signs and symptoms. Here's what's happened. Here's what's looking. Here's what we need to do. Here's what we need to do to live a normal life. We need to have adequate sleep, good nutrition, active lifestyle, mindfulness, breathing, you name it. Okay, what happens when we see these signs? What do we do? Okay, well, AJ now has this medication. Perfect. What happens when we're in these delusion states? What's going on? We need to protect AJ, and then we need him to sign into a hospital. We need to break that down. And unfortunately, it's taken 7 years to get there for me. But I'll say this, everything happens for a reason. I there's this stigma, and there's this this sediment of being mentally ill, of being what's the word? I guess the word is ashamed, and you shouldn't be ashamed for it, and you should always be learning. But that's why I'm here. That's why we're here. That's why Team Garbo's doing what they're doing. That's why they're supporting, organizations like NOMNI that are absolutely just the core crux of the foundation of mental health and really educating people, helping people. So yeah, it's been quite a ride. I've learned a lot of those are, and all those times that I just described, that adds up to maybe 21 days in my entire life that have changed my life drastically, that have made my life worse. I have bounced back, I have recovered, I have, wept in my bed thinking I was never going to be normal, I was ever going to be the same ever again. So I don't want that hardship for anyone else. You have to keep learning. You have to learn what's best for you. And even brings us to present day. There's things that I need to do day in and day out. And it's a day-by-day battle. That's what it is with mental health. You have to take care of it day by day.
Yeah. And I think that's good. I think that's good to touch on specifically, when you're saying the strategy, right? So an individual is diagnosed with bipolar disorder. What's next, right? I think, you touched on that, shame or people are embarrassed to talk about it, or embarrassed to say, to just even face the fact like, oh man, I was just diagnosed with bipolar disorder. Whereas realistically, the first step should be immediately following should be, hey, let's make a plan, let's set a strategy. I think it's really, even for those of us that don't have certain other chronic type illnesses, that don't involve mental health, I'm sure we could all probably say, oh, we know what the treatment plan is, or what an individual should do if they have high blood pressure, or what they should do if they have high cholesterol, things like that. I think it's...
Let me jump in, and I totally agree with you here. Let me tell you a story. There is no difference. Mental health, physical health, any ailment. I played football with a guy, I'll leave his name out, but he was a couple years younger than me, and he had diabetes. I wasn't too sure of what form, but every day he came down with a duffel bag of stuff to get his I guess it's the blood level or the blood sugars, juice boxes, some things, and he did it every day. Every day of practice, he had that taken care of. Anytime I saw him outside of the football field, he was taking care of it. Every day AJ Garbowski came down to that football field, he had a bag, a hypothetical mental bag that he had to carry around with him. And everyone has to do that. You have to. You can't just break your leg and expect it to be healed.
Yeah, and I think it's a great example in that, right? That individual, they don't walk around hiding their bag for their diabetes, or hiding their juice boxes, hiding all the medication, right? Because it's just like, this is what I have to do, right? This is what I have, and this is what I have to do. And I think getting there, working to that, is definitely important. I think that could help a lot of people just trying to work toward feeling comfortable to just say, I need a plan, and just accept that, this is my strategy for to live an optimal life. And I think, it doesn't make you any lesser than, right? It's just, that's just your plan. That's what you need to do. I think that's really important to touch on.
And I think exactly what you're saying. Everyone needs a plan. I'm not sitting in front of you saying I have it all figured out.
No,
I am the epitome of health. I am, boom. I don't have it all figured out, but we're constantly working on it.
Yeah.
We're constantly working together. And even if you don't have someone like I have a Frank, I have a Team Garbo boards, and I have family and I have friends, you can reach out to us. You can reach out to certain people, and we will help you, get the support you possibly need. But it's a constant work in progress on yourself and your overall health, and whatever ailment you have. So it starts with the person within. It starts with the man in the mirror. I mean, I keep going back to football, but I had a coach that gave us a poem, and I don't know verbatim the poem, but it was called "The Man in the Mirror," and it reflected, you basically are, the person that you look into. You control who that person is, and it really, it starts within. It starts with this. I'm going to figure it out. I'm going to take care of it. And for me, it's been a rough ride. I mean, I missed a collegiate football season, semester at school. Had to resign from a job. Just recently, had to spend some money on my savings I did not want to spend. But I've recovered. I've learned, and this is just, it's like you're constantly figuring out what you've done and where you're going to go. But it just starts. I know it was always going to start with me. So, and I was going to be the motor to my life. Was I going to get help from other people? Yeah, absolutely. I'll take help my entire life in any aspect of it, but you need to be the motor, you need to be the gas, you need to go. And people need to realize, whatever they're going through, like you're saying, it's an everlasting learning process, and you're the driver.
So some questions that I know we've gotten are about your experience being hospitalized, right? I know you had mentioned during your manic episodes, you've been hospitalized 3 times in the past. Can you talk a little bit about those experiences as far as what it was like? How you were treated? I'm sure that's something that people are probably a little bit, maybe have some fear of, and I think it's probably because it's just unknown. So, can you talk a little bit more about that?
Yeah. So it's definitely doesn't have a great stigma behind it. Hospitalization, just coming from I've never would want to be. You hear psych ward, and it just has a sting to it. Mental hospital. So I will say this, that the core philosophy for me going through a hospital is to simply just treat me. Is to treat the symptoms going on, treat the case, help me get through this, manic episode that I'm going through, get me back onto an eating and sleeping schedule. For that part, it's done. The form of a hospital, they do a great job for people that are really, really, really in need. I'll say that there's aspects of it, and I never want to step foot in a hospital ever again as a patient. I don't want to do it. It's the last place that I want to be when I'm there. It's the scariest places that I've ever been to. It resembles almost at a time, because you're not well enough, or you don't have everything together, but you're recovering. At the same time, you feel like it's really doesn't feel like you want to be there. So I mean, I have really valued being in the hospital after. During that, everything is going on. It's really challenging. So you have to tip your hats to everyone that works in the hospital system for the work they do. They do tremendous work. They have tremendous hearts. It's very challenging, and you're not just getting anyone. You're not just getting a flock of people that have bipolar disorder. You are getting thrown the kitchen sink. There is a lot of people that have a lot of things going on. So the patients, the workers in there, the nurses, the techs, the doctors, it's commendable. It's really a really tough line of work. With that being said, I mean, my experiences have been very, I want to say hit or miss, but I won't say I've had a great experience and I've never wanted to stay. I've known people that feel really comfortable and safe into a hospital, but every time I get in there, I want to get out.
Yeah, and I think if I can cut in there, and I think to shed some light on that, I think it's also worth noting, right? Because these experiences, when you're there, you're at a level in your manic episode where you need drastic intervention, right? So you're not at a very positive place. It's not as though you're going there for a rehab type of situation, right? So I think that's worth noting, like you said, right? It's tough. You don't want to say it was really positive because I mean when you're there, it's a tough spot. You need a lot of help, and you're at a point where you really need almost a full reset. So I think it seems tough to say that it would be a positive experience, but I think, would you say that you at least found you got the proper the help that you needed?
Absolutely.
Okay.
Absolutely. Looking back on it, I am very grateful to have been treated by such professionals. At times, I'll say that, and I know they have a lot going on, but sometimes, you're kind of getting treated by your case, not as a person. And that's okay. These doctors have to run all over the place, and that's the difference. Like, I've had fantastic doctor treatment outside of hospitals, and I've had good doctor's treatments, but at the same time, it's like they're really treating. Hey, it's like going to you've worked in an emergency room. It's way different than when you go visit a family doctor to an emergency doctor. They are treating an emergency. Mm-hmm. So I've had a lot of doctors been very informative, straight to the point, and I've had some good experiences with some great workers that just on the other side of it, the nurses that are there and the staff, gems of people, because I'm looking around, I know how I feel, I'm looking around to see what they're dealing with, so really, they don't get enough credit.
Mm-hmm. So I think I would like to touch on something that I think a lot of people aren't as aware of, and I think you've had experience with this, and that would be the other aspects of bipolar disorder. So you had touched on depression. I think a lot of people are familiar, or at least have heard of the manic episodes that require the hospitalization, that require some more of that intensive interventions. But I'm curious if you could touch on more of your experience with bipolar disorder as the other symptoms on that spectrum, right? So maybe those, the depression or those coming down afterwards, right? I think those are just as important, and I think probably just as much of a struggle and something you have to work on. And it's not just about those manic episodes and avoiding them, but also the stress, the anxiety, the depression, those other aspects that come with it that I think probably aren't as well known, but people may also be, experiencing and dealing with.
Well, just to cover this very, very briefly, I mean, I have a chemical imbalance. Mm-hmm. You can call it a mental illness, but deep down in science, in my head, some neurotransmitters aren't getting what they need. Mm-hmm. I have a chemical imbalance. And really, I'm a firm believer that you should be taking medication if you have a chemical imbalance. There's science out there, it works, and really, I have had to, and I'm saying this now as I've had to do it after my mania. I've had to tweak medications, work with what works, and honestly, these are some of the miserable, most terrible times of my life, the lowest of lows. I've never felt lower after these manic episodes, to where I'm feeling this deep down depression where hopeless. Hopeless is such a tough word to come out of someone's mouth, but that's how people feel. And to anyone out there, I've had to really do extensive counseling. I had to dive in with my doctor, find out what's the right fixture for AJ, and this takes time. This takes time. In February I was hospitalized, but it took maybe until May to find the right medication, the right fixture, and then it just takes time to turn. So in this meantime, as you're battling this depression, which can get increasingly better with medication, but that takes time to link in. And then you have this anxiety. So as much as I started off with medication is such a necessity, also is your lifestyle.
Mm-hmm.
And this really ties in. I've had questions of like people are like, well, what are you doing during COVID-19, and what are you doing to keep yourself busy? But let me paint a picture for everyone. When I'm in a manic episode and I'm on a medical leave of work, I'm doing nothing. I'm sitting out and I'm looking at my curtains, laying in my bed for hours on end.
Mm-hmm.
And it's some of the loneliest time that I'll ever spend. And it's challenging. It's really tough. It's a place that like I've been talking about myself, and I talked about like who I am, and like
mm-hmm.
how like the first time someone's like, yeah, we were bipolar. Like, well, I never have the down. Mm-hmm. And when that down comes, you have to give it everything you got.
Mm-hmm.
Everything you got. You have to give it everything you got. And even if that's like your energy level is at 1%, mm-hmm. you have to give it. You have to give it. Yeah. And so what I have done in those circumstances, I've extensively worked with my doctors, extensively worked with my counselors, taking what I can to myself, making a routine. It's really known that bipolar people do well off of routine, their circadian rhythms. This works for me, and we're talking, I will plan out a 10-hour day from 7 a.m. I guess to whatever that is, 5 p.m. Each hour doing things, doing that, and I've worked with my counselor, who's great. And I have to do it. You have to just keep it structured, keep it organized, day by day. It's been a motto of AJ Grabowski for a while now, and you have to fight it day by day. And if you win that day, that's awesome. Let's go to the next day. Mm-hmm. And with that depression, it gets better and better. It does. It does get better and better. It works. You need to put these tools to work. You need to work on your self-talk, work on your positive thinking, work on journaling if that's what helps you. Mm-hmm. Take that anxiety that's a byproduct of bipolar, which is a pain in the ass. Everyone's got some sort of anxiety, but you got to be able to handle it. You got to find a way to do it. So I'm glad you asked about this, because listen, like if you look at a movie of my mental health, you think, oh man, like the climaxes are always the manic episodes. But these depression bouts, those are the ones that hurts. Mm-hmm. Those are the ones when you're told that you can't go back with your brothers to play football for your second year, which is hopefully going to be a huge year for you. Sophomore year typically is. You can't go back, and all your other friends from high school, they're gone, and you're spent months battling this depression by yourself, wishing you were somewhere else, wishing you had the energy somewhere else, or maybe even, thinking that, but it's the longest, it feels like the longest time, but when you're in that, you have to take it day by day. You have to take that duffel bag, those tools, you got to bring it to work, and you got to go every day, and you got to give whatever you have, even if it's 1% on that. So thanks for asking about that, but that's another huge part of it.
Yeah, and I think it's an important aspect to touch on, whereas, not everybody who may be listening or may see this video can necessarily relate to experiencing a manic episode or having bipolar disorder, but I think, something that is extremely common, as we hear over and over again, is the anxiety, and specifically those depressions. So I think that's something that, those feelings that day by day, I think that's really important. I think that's something that I've obviously heard you say before, and I think it's important for everybody to know, and just that fight and that grind, which, it gets better. And I think that's it's good to know.
It does.
Yeah.
It does.
What are some things, I know we've talked about, obviously, Team Gargo's here. What are avenues if people are feeling like they need help, they want to seek out somebody? What are some avenues that people can take that you have experience with or that you can talk to more?
Yeah, just so for a general starting point, if someone is looking to speak with a counselor, psychology.com
Mhm.
is a great resource that actually can link you up to your own health insurance, and it can see who's kind of in your price range, what specialties professionals have. Obviously, if we're talking, if someone's in need of some serious help themselves or with someone else, they can always reach out to Team Garbo. We can talk with them, see if there's anything that we can do to help. But something that's been really strong in my family's presence and Team Garbo has been the National Alliance of Mental Illness. We've seen to be, so they're called NAMNI, but National Alliance of Mental Illness. And we've seen them to be such a great resource of information, peer groups, support groups. There's other places that we support as well, but for the most part, that's what I know firsthand. I would also, when we're talking about making that plan, know what's around you. I mean, I know we're located, right in Bucks County here, so we know that Doylestown has a crisis center. They have a crisis hotline, a crisis center. Know where to know your resources, know your hotlines. We have hotlines and that we can send people, and so does NAMNI. So that's my biggest tip, is just be aware, because you would know where the hospital is if you broke your leg. Know where a crisis center is for someone dealing with that help.
And I think that's important. I would say for individuals who may have friends or family that they feel might need help but aren't ready to maybe talk about it, or aren't ready to open up about it. I think same thing. Being knowledgeable will never hurt. So do the research, like you said, know the hotlines, know the numbers to call. So if there ever comes a time where you need to use any of those resources, you know immediately where to go, and you don't feel lost or unsure.
Yeah,
I
would agree. Also, I mean, really, it comes back to the whole education piece. Is if you knew, what we knew before things happen, you're more likely to respond in a correct manner, and so educating yourself, or education processes, whether it's school programs, they're huge. They are huge, because if you're educating, then there you throw away stigma. Then you throw away the crisis part. We're like, what do I do? So I think it's huge for everyone to take some responsibility. If they have friends and family, and even if they have friends and family that don't have mental health, it's very good practice to know.
To kind of summarize it, wrap it up, I would like, and this might be challenging, so hang in there. Do you think you'd be able to summarize in, let's say, a sentence or so, what the ideal world as far as handling mental illness looks like? In what's the ideal situation? What would you like to see the current society as a whole, how mental illness is handled, how it's educated? What do you see as the ideal?
You said that's tough. I think it goes back to two core things. It's like acceptance and knowledge, because I just know when you get a cut on your arm, we're gonna put pressure on it so it stops bleeding, right? That's just acceptance of, okay, you can get cut, and then knowledge. So let me put pressure on that. Let me put Neosporin on that. So I would have to say, and there's so much to be done, but acceptance and knowledge of mental health will go a long way for this world. Well, it's not really a sentence, but
no. I think those two key points. I think it's well said.
Yeah.
Lastly, I think I just kind of wanted to touch on overall, kind of from the outside, we've talked a lot about you. What would you say to, the friends and family, right? So to the individuals who may be struggling, what would you give advice to those who may be listening to this and have maybe not experiencing bipolar or any kind of mental health, illnesses in themselves, but have loved ones, have friends that are going through this? What would you say to them? Are there, specific tips? What's the approach, right? How would you recommend? I know it's a big question, but is there anything off the top of your head that you can kind of really talk to as far as, really just tips, help, advice?
Yeah, and I think I'm going to go back to why we started Team Garbo here, why we bound together as a group, because it took a team to really help save a very much struggling young man, and it took a team to kind of keep him going. But what if we lived in a world where it didn't have to take that? And we don't live in that world right now. And I know whenever we were getting educated on mental health, I think it was AP Psych, I think we covered maybe a day and a half on it. And I'll tell you what, I was only worried about the football coaches that were coming to see me. I was not paying attention at all during those times. And now it comes hit me, it hits face first. So my biggest tip is, one, be open to it. Be open to learning about it. Be open to hearing someone's story about it, because you have no idea when this is going to come. You have no idea. And when it does, you're going to want to be informed. You're going to want to be ready. You're going to want to be ready. Because if I didn't have a huge team of people flock to my side at my darkest of times, I don't know where I would be. So I'm very fortunate. There's other people out there that don't have that. And it doesn't have to be that hard. And if it requires everyone to just open up a little bit more, learn what's going on, and educate themselves, talk, and be okay talking about it, that's going to change a world of difference. And that's why Team Garbo is a thing. We are here to help, to spread the word, to connect people in need, to people that could help them, to share our experiences, but just really be an advocate for mental health awareness. And I think people can be capable of doing that.